Hey, it's your boy Lyan. What's up? So this week's subject is dysphoria. So for me, I've had. I'm gonna say. I get dysphoria in three ways. Or I've had dysphoria in three ways. So my voice is probably the main way that I get dysphoria. I get called ma'am a lot on the phone, which is so annoying. Or when I get really excited in a conversation, I notice that my voice gets really more high pitch. It gets high pitch, and I hear it in myself. I hear the feminine tone for myself, and I make myself mad. But it makes me even more mad when I get called ma'am on the phone. It's like, no, you're talking to a sir. I'm a sir. Hi. But they can't see my beard, so they wouldn't know. Um, like, I love to sing, and I'm not saying I'm a good singer at all, but I love to sing, and my singing voice is so feminine. I feel like I sing like a girl, mostly talk like a guy. But that's one of the things that I deal with a lot is hearing my voice and thinking it sounds feminine. I don't know if everybody else thinks it sounds feminine other other than on the phone, but I hear something feminine often. Um Now let's work our way down. We went voice, now we're going to go chest. I used to have very bad chest dysphoria. I had pretty big, knockers. And ooh, I don't know who those people are. Anyway, I used to have pretty big knockers, and so yeah, I already said that. And so I used to use a binder. I had an Underworks binder. It was amazing. I had two of them, and I used them both every day. Binding with two binders, I wouldn't recommend it. It caused a lot of pain, and it was pretty uncomfortable. At one time I got this pinch on the side. I think I pinched a nerve or something, and I would get shooting pains up the side of just my side and like one part of my back. So I had to stop binding for a couple of days. After that, which good thing it was like I stopped at the weekend, so I had like 2 days off or whatever, and then I went right back to using two binders, which is terrible. But I've had top surgery since then, and now I'm very comfortable with my chest. I love this what my surgeon did. I it feels so amazing to be free to just have a tank, like literally just a shirt. I just have a shirt and a tank top on. I don't have to wear anything else, and that's a blessing. Um, Bottom dysphoria, since we're moving down. Yeah, I don't have too much bottom dysphoria. I have dysphoria when going to the bathroom. Because right now I use a Go Girl. It's purple, but I can use the bathroom standing up. It gives me no trouble. It works so well. I don't have any leaks or drips or anything like that. I'm still working on feeling comfortable using the urinal. Words. Hi. Anyway, yeah. So I I'm getting more comfortable using the urinal. I use the stall mostly. Even though I'm standing up, I just feel more comfortable. I worry that somebody's going to look and see something purple. I doubt that anybody's looking at me, but that's dysphoria for you. You think that you're thinking all these things about what other people are thinking, and and anxiety for you. You're thinking that all these people are thinking all these other things when probably they're just thinking about themselves. I don't really pack. I'm not comfortable packing. I don't want to just put something in my pants to just sit there and just be hanging out. If I had an STP and it had a function, I would so enjoy packing. But right now, when I do pack, it gets in the way of using the STP I do use, which is the Go Girl, and so I can't pack and feel comfortable because it gets in the way. So hopefully one day I'll have an STP that I can use. that's probably where my main dysphoria is the fact that I need to use the bathroom and I need to use something purple. But it's okay. I don't pack on the regular. I don't pack on the daily. Very rare occasions are probably swimming, because shorts, when you get them wet, they stick to you, and I don't want people seeing there's no bulge. But for everyday packing, I don't. I don't think anybody's looking down there, and if they are, ooh, good for you. You figured out I'm a man with a V. I don't care. I'm very proud of who I am. I'm proud to be a trans man. I'm proud to be a man with a V. I'm comfortable with it. I'm very comfortable in my own skin now that I've had top surgery. And if people are out there and don't like that I'm a guy with a V, kiss my ass. I don't care. I love me. And once I've started to accept that about myself, and started to really love who I was, I stopped caring. And my dysphoria decreased so much. Top surgery did a lot for my confidence. So for me, being a trans man is how I identify. I don't tell everybody in the world, and not everybody needs to know. But the people that do know I feel, are privileged. They get to know a secret, kind of. And that's just how I live my life. I used to have a lot more dysphoria when I wasn't working the job that I'm currently working now, actually. I used to work in a nursing facility and not working where I'm going from patient to patient. And when I worked in a nursing facility, I started off being Misha. That was my old name. And I have no problem saying my old name. It's not like dead to me or anything like that. It's a beautiful name. My mother gave it to me. I love my mother. And it just wouldn't work for me. I couldn't keep that name and be this. So I'm Lyan. And at my old job, I got called my old name so often. And that was uncomfortable for me, because then patients would go, why'd they call you Misha? Or why'd they say she? And then I don't need anybody else outing me. And if I want to tell somebody who or what I am, I'll do it. And at my old job, I was often outed by my staff to patients and patients' families. I don't have that problem now. So that dysphoria is gone. All the people that I work with now see me as Lyan. My name badge says Lyan, and I'm only seen as Lyan. And that alleviated a lot of dysphoria. Well, I guess that's all I gotta say. Lyan, out. Peace.